Hello and welcome back to GP Video Podcast by Nadia. As I promised yesterday that I would be talking in detail about perinatal mental health issues because they are very common and very significant and not really diagnosed promptly, underdiagnosed, and do create a lot of issues. So today I will actually take you through the proper notes and proper article about it, and we will talk about perinatal mental health issues in detail. So we will first go through the definition of perinatal mental health. Perinatal mental health issues refer to the period from the point of conception to a child's first birthday. So remember yesterday when I was talking to you about perinatal mental health, I said it's any time from the time of conception up to 6 months after the child's birth. But no, the definition has been revised. It says any time from the point of conception of the baby up till until a child's first birthday. So 1 year after the delivery, till 1 year after the delivery. It encompasses several different mental health conditions and components far beyond the traditional understanding of postnatal depression only, and has an important impact on families and society. So usually when we talk about perinatal mental health, we only usually think about perinatal or postnatal depression or postnatal blues, and that's what our major understanding is. But that is actually not true. Perinatal mental health conditions involve or encompass a lot more complicated mental health conditions. And I'm also going to tell you a very important aspect, that it's not only that the women suffer from this, there are 10% of fathers who suffer from this as well. Now, whether it is related to looking at their partner and getting affected by that or other components, we will talk about that as well. In part, the huge burden and associated cost is driven by how common these problems are for both men and women. These issues are more common than any physical health problem in pregnancy, so there is a need for GP to look for and manage them to ensure the best outcomes for families and children. So it is also a very interesting point that we think that the physical health issues are more common in pregnancy than the mental health issues, but that's actually not true. So this affects 1 in 5 women and 1 in 10 men, and include conditions beyond depression and psychosis, such as post-traumatic stress disorder, obsessive compulsive disorder, anxiety, and adjustment disorder. So again, very important point. Perinatal mental health issues affect 1 in 5 women and 1 in 10 men in the Western world that we are talking about. I do not know about the incidence of this in the third world countries. I don't know if it's higher or lower or if it's the same, but this is the case in Western world. Currently, 45% of pregnancies are unplanned, which can increase the risk of perinatal mental health issues, particularly in second or third pregnancies. So we are now talking about the risk factors. So what is the risk factor? Unplanned pregnancy, which can increase the risk of PNMH, and particularly in second or third pregnancies. Only about 50% of these issues are identified, and only half of those are treated effectively. So out of 100 women who suffer from it, or let's say 100 men who suffer from it, only 50% are identified, and in those 50% also, only half of those are treated. So just imagine out of 100 people suffering from it, only 25 people are getting properly treated, which is not a good number, not only for themselves, but also for the kids they are looking after as well. Only 40% of women report bonding with their baby immediately, despite social pressure to do so. This is compounded by social media and societal norms. So I was actually listening to this podcast today, and I'm just reading you for the key take home points from this. And this was something really very new for me to learn as well, but this actually makes a lot of sense. We expect women, mothers who give birth to their kids, to have straight away an affectionate bond with their kids and just be able to love their kids and adore their kids and be able to do anything for their kids from day one. But that is actually not true. Only 40% of women report bonding with their baby immediately, while the 60% might take their time. They might just not like their babies straight away. They might just not develop that bond straight away. They might take their time. They might do it in a couple of days or in a couple of weeks or in a couple of months. What stops them from expressing this is the societal norms and social media pressure. So this is again, and because it is very common, it is very natural to happen, to not have a bond with your baby straight away. It is very important for the GPs to explore that part and then address that part and give the women a bit of counseling, and the women go through psychological counseling as to, this will happen, and how to go through this phase when you are not feeling the bond for your baby. So that is also one of the most important triggering factors. Adjustment disorders can present as various symptoms in response to stressors and may persist until the child's first birthday. So as I said, that there are a few conditions apart from depression and psychosis. Postpartum psychosis is actually one of the worst things that we will talk about. But apart from that, we can also have post-traumatic stress disorder, especially if the pregnancy itself and the birth itself has been a traumatic experience. Also obsessive compulsive disorder, anxiety, and adjustment disorder. So adjustment disorders can present as various symptoms in response to stressors and may persist until the child's first birthday. Greater attention is needed on mental health, as physical health often takes priority. So again, when a woman comes to a GP for a 6 weeks perinatal checkup, it's important for GPs to, apart from physical health, also explore their mental health. I'll talk more about this topic tomorrow.